Today, we're going to talk about diabetes, type 1 and type 2. Let's remember, life is all about balance. Too much or too little of anything can throw us off of course. And just like our physical lives need balance, our spiritual lives need balance too. The Bible says in Proverbs 11, verse 1, a false balance is an abomination to the Lord, but a just weight is his delight. One of the clearest ways we see this principle demonstrated through our body is through our blood sugar. Diabetes is a condition that reveals what happens when balance is lost. And today, I want to teach you what that means, how it affects your health, and how you can take steps towards restoring your balance with faith, lifestyle, and the appropriate individual health coaching plan. In type 1 diabetes, we have the immune system attacking the pancreas, destroying the cells that make insulin. Insulin is like a key that lets sugar into your body cells that is used for energy. Without insulin, sugar builds up in the blood and can become dangerously high. People with type 1 diabetes must take insulin every day to live. In type 2 diabetes, the body still makes insulin, but the cells don't use it properly. This is called insulin resistance. Over time, the pancreas cannot keep up, and blood sugar continues to rise. At first, this may be managed with lifestyle modifications, healthy eating, exercise, and pills. But sometimes outside insulin becomes a requirement. So let me simplify the difference. In type 1, there are no keys. So you will need insulin from the outside. Pills do not work for a type 1 diabetic. Then we have type 2 diabetes. You have keys, but the locks, they are rusty, and sugar struggles to enter into the cells. Now, let's talk about normal blood sugar ranges. Before your meals, your blood sugar should run between 70 and 130. Then after 2 hours of eating, your blood sugar is expected to be below 140. And then we have a test that we conduct. It's called a hemoglobin A1C. And it measures your blood sugar over a median of 3 months. And this number should range below 5.7%. And these are considered normal. Even though diabetes has no immediate cure, people can still live healthier and stronger lives with the right plan. God calls us to be good stewards for our bodies. A health coaching plan can help bring both discipline and hope. I highly recommend that an endocrinologist is on board with all diabetics. This is a specialist who will guide your diabetes treatment and adjust insulin and or medications. Next, there should always be a primary care provider on board who will oversee your primary concerns and overall coordinate your care, even with other doctors. Now, other specialists may be needed, such as an eye doctor, that's called an ophthalmologist, a kidney doctor, which would be a nephrologist, and or a heart doctor, which is called a cardiologist, because diabetes can affect the whole body. It is highly recommended to follow the American Diabetes Act diet. This looks more like vegetables, lean proteins, whole grains, and healthy fats, while cutting back on sugar, refined carbs, and processed foods. So instead of grabbing a soda or potato chips, choose water. Instead of white bread, go for whole wheat. Instead of fried foods, try baked or grilled. with less butter. These small choices can help keep your blood sugar steady, balanced, give you lasting energy, and protect your heart and kidneys in the long run. Of course, exercise is a key factor in managing diabetes. Things like walking, bicycling, stretching. These are some things, and not just walking, but walking to where you actually can feel your body sweat. So you want to walk up where you feel your heart rate increasing and your body sweating, at least for 15 to 30 minutes a day, 3 to 5 times a week. There should be some form of exercise. And then next we have hydration. Water helps flush extra sugar out of the blood and keeps the body functioning well. And then we have sleep and stress management. Your body heals when you rest. Now, keep in mind that foods high in sugar, skipping your meals, taking your medications, poor sleep, stress are some of the biggest everyday triggers in diabetes. Being sick, having an infection, can also cause you to have high blood sugars. Taking steroids can cause you to go into a hyperglycemic condition. So anytime you're prescribed steroids, please consult with your team about probably adjusting your insulin or any type of pills that you are taking for your diabetes. And then we have alcohol consumption. I highly recommend a discontinuation of all alcohol consumption because this can also cause you to go into a hyperglycemic condition and even a DKA state. Diabetic ketoacidosis, which is a very, very critical state for a diabetic. And last but not least, dehydration. Not drinking enough water makes your blood sugar, it makes it more concentrated. So staying hydrated is a key factor in a successful, balanced diabetic plan. Diabetes reminds us that life without balance is dangerous. The body needs insulin to unlock energy, and our souls need Jesus, the true key to unlock abundant life. So I encourage you today, take small steps toward bettering your health. Maybe drink more water. Swap out a sugary snack for a healthy fruit that you like. And go for like a 15-minute walk where you actually work up a sweat. Partner with the right care team, whether it be a doctor, a nurse practitioner, a physician assistant. Include a dietitian if necessary, and even a health coach who can walk alongside you during your journey. And most importantly, invite God into your journey. He cares for your spirit and your body. As Jesus declared in John 10:10, I have come that they may have life and have life more abundantly. Your health is a part of abundant life. Choose balance, choose life, and let God guide you into wholeness. Your body, your mind, your soul, and your spirit.